It's time for Work Comp Talk. Coming to you from the Pacific Workers Studio in Concord, California. It's Work Comp Talk. Interesting people talking about the issues that affect the lives of the everyday people that keep our communities moving. Sponsored by Pacific Workers Compensation Law Center.
Hey guys, thank you for joining us once more. Today, joining me is Bilal Kassem, which is CEO and co-founder of Pacific Workers. And we're going to dive into today's topic relatively quickly. I wish we had more time to dive into it deeper because there is a lot of questions that go behind this topic. And without further ado, today's topic is workers' compensation medical treatment. There's so many questions that come about this, especially for someone that's going through a workers' compensation claim. So who best than Bilal to join us in this conversation? So let's talk about medical treatment in workers' compensation. What is the medical treatment in workers' compensation?
It's a nightmare. It's a nightmare. You know, most people, I think, look at medical treatment in workers' comp and say, look, I've been injured at work and I should get the care I need in order to recover, and that shouldn't be my problem.
Right.
Well, it's not the case. You know, more often than not, it's an incredibly difficult system and people get lost in the system and they really don't get the care they need. You know, it's problematic at best.
Is this because of the worker being the one that actually doesn't ask for the help? Is it because they don't know better? Why is this happening?
So normally if you get hurt at work, your employer is actually supposed to refer you to a doctor.
Right.
And you don't get control over that doctor at first. It's the insurance company who's really telling you where you need to go. And oftentimes that doctor is not always the friendliest doctor. It's the preferred vendor for the employer for a reason, more often than not, because they're probably not going to be on your side.
Right.
And unfortunately, the law is set up so as an injured worker, you don't get the control over the medical care you need to begin with. It's a referral-based system. So if it's an injury happens within the first 30 days, the control over your medical care is all up to the employer.
So you mentioned something about the medical provider network. What is the medical provider network?
So in California, employers and insurance companies have the ability to work within what's called a medical provider network. And it's a network of doctors. And ultimately, you have to stay within this network in order to get your medical treatment. You can't go to your primary care physician. You can't go to your neighbor next door. It has to be this authorized doctor and it has to be pre-approved.
Okay, so this is something similar to regular insurance. You know, you got the in-network doctors you can go to, and then the ones that are out of network. So it's very similar in the sense that it's a specific list that you can go to because it's a work-related injury.
Yes, and these are all pre-approved doctors. You know, they're doctors that have gone through the process to become part of the insurance company's medical provider network. And yeah, once they're on there, they're good to go. They're an approved doctor.
Nice.
Of course, that just means you get to see the doctor. It doesn't mean you get the medical care you need. That's a whole different ballgame.
Yeah, I've heard some scary stories of people feeling like they haven't been heard. The doctor's really not trying to listen to their symptoms or to what they're saying their symptoms are. If you say, hey, you know, my back's been hurting, and they'll tell you, okay, from 1 to 10, what's your pain? You say it's a 10, the doctor puts a 5. So it's technically not being heard by the doctor.
Yeah, and sometimes these doctors don't have your best interest in heart. You know, you could be in a scenario where the doctor wants to keep getting business from the insurance company, and they have this I guess pressure to stay within the medical provider network and please the insurance carrier so that they don't get booted off the network, so they don't lose business.
Oh, dude, that sucks.
Yeah, it's pretty bad.
Do the insurance companies then have a say when you need to get any type of medical treatment authorized?
Yeah, absolutely. They have everything to do with it. So normally if you go to your doctor, right, you walk in, you say, I have a cold, your doctor prescribes you some medication, whatever the case may be, you get it same day, you go home, everything's good.
Right.
Not in workers' comp insurance at all. So doctors have to submit what's called a request for authorization. And that request for authorization then goes to the insurance company, and the insurance company has the final say in whether or not you get the treatment.
But the insurance company is not a doctor. How do they know what you need?
So this is the problem, right? You have this doctor who says, yes, this person needs medical care. But the insurance company has their own department, utilization review, which is filled with doctors that actually work for the insurance company who then say whether or not the treatment you need is medically necessary. Yeah, so of course you have the insurance company who has to pay for medical care determining whether or not you should have the medical care.
It's a mess.
Yeah, of course. They're not going to want to pay for it. And so I'd say probably, the large majority of the time, you have these insurance companies that are denying people the care they need, and it's purely for financial reasons.
So it's just to look out for them as well, more than anything. They don't really care
Yeah.
about the patient. It's more insurance companies just trying to save a buck or two.
It's the bottom line.
Yeah.
100%.
So what is the independent medical review and how does that work?
Okay, so if the insurance company denies the medical treatment that's been requested,
Right.
you have the ability to appeal that decision.
Okay, so say they just denied whatever it is that you had. You have a back pain and they just say, no, we're not going to do anything. You can appeal that.
Yeah, I mean, the appeals process isn't very clean.
Oh, gosh.
So back in the day, it wasn't too long ago, maybe, since pre-2005, maybe earlier, there used to be a different process for all of this stuff. We used to be able to go to court and fight over medical necessity, and a judge would actually look at the medical records and make a decision.
Oh, wow.
Now we go to independent medical review. And independent medical review was this process that's been created, and it's an alternative where there's these physicians, you don't know who they are. They're contracted by the state to review utilization review decisions and determine whether or not that decision should be overturned.
So they're for the state, not for the insurance company.
Correct.
Okay.
Of course, we don't know who these doctors are, whether or not they're actual doctors, whether or not they're actually qualified to make these decisions. And so you have, perhaps an orthodontist who would normally work on teeth actually be looking at someone's, request for back surgery. That may be extreme, but I'm just kind of, haphazardly, I'm kidding about the fact that really there's so much ambiguity in the process. It's not a good process. And I think last time there was any kind of study on it, there was something like 80 or 90% of decisions were upheld by IMR, which means the appeal was denied. And the appeals process takes time. It's not immediate. So if someone needs urgent care and they're not given the care and they have to wait, a lot can go on for that person. It can be 30 or 60 days. So even if they get a favorable decision, it can be a really long time, and it's not good for the injured worker.
In this case, I would hope that if this is your situation and you're in the middle of it, the best bet would be to get an attorney on your side, to have someone actually be there and tell you which is the right way to go. And this is technically something that's not easy. A lot of people can handle smaller injuries, I say, within workers' compensation. It's something we've mentioned before in the past, where you can go through the system pretty easily when it's a smaller injury. But when it's something where it's involving and you're getting denied and it's just a mess, then that's when you definitely want to get an attorney on your side. Pacific Workers, you can check them out online at pacificworkers.com. So what happens after you get an independent medical review, which is also known as an IMR?
Okay. So it depends on the outcome. So if you file an appeal and your appeal is successful, the insurance company actually has to authorize the treatment, which is an awesome victory. Few and far between, but they happen. If your appeal is denied, well, that's the end of the road for you, unfortunately. If your doctor had requested back surgery, utilization review denied it, then you go to this IMR process and IMR says no, then your appeal is done. That's it. No surgery. No surgery for the time being, I should say.
That's what I was going to say. What do you mean, like no surgery? Is that the end of the story and that's that?
For the foreseeable future, utilization review decisions stand for 12 months.
Okay.
So, you'd have to wait a year for your doctor to actually request authorization for the surgery again and have them submit it through the utilization review process. Now, if something's changed and, for example, utilization review said no because you didn't have an MRI, and IMR said, yeah, you should have an MRI, so we're going to uphold this denial, but then you go and get an MRI done. Well, at that point, then there's this change in material circumstances that really impacted the decision, and you don't have to wait 12 months.
Okay.
So, there's a lot of these little quirks that go into the process. Utilization review decisions themselves, they have to be communicated within 24 hours to your doctor. IMR decisions have to be communicated within a certain time. Utilization review needs to be communicated, not only to you, but if you have an attorney, to your attorney, and it also has to contain certain items, just like the IMR process does too. And there's a lot of minutia that goes into this, and it really is not something that you would know about if you're an individual. Some people don't even know how to fill out the forms, let alone actually, ensure that the forms and the stuff they're getting is proper.
Right. It's the whole mess. You were not kidding about the beginning of this. The medical treatment behind it can go into like webs and then just disperse into many different levels. So why does having a lawyer really help? How does that make a difference in someone's workers' comp case?
I, I mean, I know I'm a lawyer, so I'm biased, and maybe and maybe it's just my experience talking, but I couldn't imagine going through a workers' comp case by myself, and I couldn't imagine trying to filter through the forms and figure out what I need to do.
Right.
There's no one there that's highlighting the important parts for you. There's no one really shining a light on what it is you need to know about. You're really left on your own.
Right.
And there's a lot of lawyers like myself who have a lot of experience, and we know what we're looking for, and we can really make sure the insurance company's doing their job, the doctor's doing their job, and we know how to fight the appeals. And we really know what to look for in order to make sure that people are really getting a fair opportunity to get the treatment they need.
Right. Now, do insurance companies have a lawyer themselves?
Sometimes. Sometimes we'll deal directly with the adjuster.
Okay.
Once a case is filed at the Workers' Comp Appeals Board, which is where we litigate cases, then generally the insurance company will retain an attorney.
Okay, good to know. So it's not an easy walk in the park, as they say. Workers' compensation can get you to very stressful moments in your life. So I think as Bilal, I've seen it here in the office to myself where there's a lot of stress, a lot of paperwork behind it. And because of the fact that you guys do this for a living, this is what your expertise is in, it's best to let the specialist handle it. And then you just sit back and focus on your recovery, which is the most important part, getting you to recover fully to go back to work to be able to sustain your family and yourself as well. So thank you for diving into this conversation with us. And we do have a workers' compensation pocket guide. If you still feel like I can do this on my own, kudos to you. You can definitely download our pocket guide. We will link it down below. So make sure you get dibs on that and try to figure out exactly what's your next step. And if you definitely do need help, you can contact the lawyers at pacificworkers.com, or you can call them at 800-606-6999, and the consultations are free. Thank you for your time, and we'll catch you on the next episode.